Hello everyone, I'm Dr. Anjan Das from Department of Chemistry, SRM Institute of Science and Technology, Pattankalatu, Chennai. So today I'm going to discuss about some common diseases, their cause, symptoms, and their treatments in the pharmaceutical chemistry. So first, let us discuss about the very common flu, that is influenza. So influenza, commonly known as the flu, is the contagious respiratory illness caused by the influenza viruses. It can cause mild to severe illness, and at times it can lead to death, especially in high risk individuals. So there are three types of influenza viruses which are responsible for this disease. One is influenza A, most common and severe, can cause pandemics. Influenza B causes several outbreaks, okay, seasonal outbreaks, and generally milder than influenza A. And influenza C cause mild illness, not a major public health threat. Okay, so how it's spread actually? It's similarly like COVID-19, so respiratory droplets from coughing, sneezing, and talking, and close personal meeting, touching the contaminated surface, and then touching the fish, and then congested places. Okay, so actually, what is influenza? So it's caused by influenza A, B, and C viruses, spread easily and can cause seasonal epidemics and occasional pandemics. Virus change over the time, so immunity can be decreased. So, what are the common symptoms of this disease? Symptoms usually appear 1 to 4 days after exposure and last 5 to 7 days. Okay, may longer in some people. So, first symbol is fever and chill. Okay, muscles and body aches, cough, headache, okay, sore throats, and fatigue. And then runny or stuffy nose. Okay, and sometimes vomiting, and sometimes it leads to death also. So possible complications, some people at the higher risk of developing serious complications like pneumonia, bronchitis, eye infections. So these are the common complication may happen when this influenza virus attacks. So young children, they are at less than 5 years old, they are uh, high risk group. Age over 65 years and elder are also pregnant women. People with chronic disease, they are kind of serious, should be serious with this uh, infection. So diagnosis based on the symptoms, clinical examination and laboratory test, rapid influenza diagnostic state, detect the viral antigens, and then PCR test also detect. So the treatment is very common, like antiviral medicine, and then supportive care. Okay, so this can prevent the influenza virus. Second one, we are going to discuss about very common another one, malaria. Okay, so this is also a preventable and treatable disease. Okay, so first let us know what is malaria. So malaria is a life-threatening disease caused by the uh, Plasmodium parasites. It is spread to people through the bite of infected female Ampullus mosquitoes. Okay, so key facts about the malaria. So malaria occurs in more than 80 countries and territories. Okay, in 2022, an estimated 249 million cases of malaria occurred worldwide. Malaria is preventable and curable. Young children, pregnant women, and non-immune travelers are at high risk of severe disease. So, how does this malaria spread? So, malaria, an infected female ampocyte mosquito. So, just uh, bite, and then parasite travel to the liver of the other person which is biting, and then parasites multiply and infect the blood cells, and then infected red blood cells uh, burst and causing symptoms, and then again that is uh, this blood is taken by another mosquito and it just spreads. Okay, so types of parasites, malaria parasites. So it could be various type like Plasmodium falciparum, Plasmodium vibe. So these are the different types of malaria viruses available or parasites available. So what are the common symptoms of malaria? It could be fever and then chill, sweating, headache, muscle pain, fatigue. Okay, sneezing and then diarrhea, sometimes anemia. So these are the common symptoms of malaria. So diagnosis similar as the influenza, RT-PCR, and then PCR test, microscopy examination. So treatment. So malaria is curable and with the right medicines. So uncomplicated malaria, like it could be treated. Severe malaria also can be treated. So, what are the prevention we can take to reduce the malaria? Like we have to use mosquito net, ventilated place. Okay. So this is the pictorial graphical representation of malaria infected countries. Okay. So yep, this is all about the malaria. So what is tuberculosis? So this is a known disease, find it, attend, and end it. So tuberculosis is the infectious disease usually caused by uh, myobacterium tuberculosis that affects the lungs, but can also affect the other part of the body. TB is curable and preventable. So, what is TB? So, TB is caused by bacteria, as I told, Mycobacterium tuberculosis. The most often affect the lungs. Okay, and it can also affect the other part of the body, such as the brain, spine, kidneys, lymph nodes. Okay, and so, what are the key facts about this tuberculosis disease? So, TB is one of the world top 10 causes of the death. In 2022, estimated 10.6 million people fell ill with this TB worldwide. TB is caused by bacteria, not virus, and spread through the air. TB is curable. A full course of treatment is essential. Early detection and treatment can save lives and prevent transmission. So how does TB actually spread? So TB spread from person to person to the air. Okay, a person with active TB cough, speak, sneeze, and sigh. Okay, the TB bacteria are released into the air by tiny droplets. Others breathe in these droplets and may become infected. So TB is not spread by shaking hands, sharing food, or touching. So latent TB infection versus active TB disease. Okay. So latent TB infection. So bacteria are in the body but inactive. So no symptoms, not contagious, and can develop into active TB disease. And active disease, bacteria are active and making you sick. Symptoms are present, can be contagious, require complete treatment. So, what are the symptoms of active TB? So, symptoms usually develop gradually over weeks. Persistent cough more than 2 weeks with or without sputum, fever, especially in the evening, weight loss and poor appetite, chest pain, and coughing of blood in some cases. And what are the possible diagnosis of TB? So, early diagnosis is important to start the treatment early and prevent spread. So sputum examination, that is one of the way under the microscopy, check sputum mucus for TB bacteria, gene expert test, and then chest X-ray, and then tuberculin skin test, and additional test, and then treatment of TB. So TB is curable with a complete course of treatment. Do not stop medicine early, even if you feel better. So, drug sensitive TB, like usual treatment duration maybe 6 months also minimum. Okay, so that is called intensive phase, first 2 months, and then continuation phase, that is the next 4 months. So, these are the drug molecule need to consume in the previous 2 months, and these are after the 2 months, like next 4 months. Okay, so how do we prevent from the attack of the TB? So definitely cover your mouth and nose while coughing and sneezing. Okay, ensure good ventilation and sunlight in house. Wear a mask in crowded or closed place. Okay, do not spit in the public place. Maintain good nutrition and healthy lifestyle. Okay, get tested if you have symptoms or were in the contact with TB present. So, who are the high risk for this TB disease? So, people living with HIV, children under 5 years, elderly people, smoker and alcohol users, people with diabetes, kidney disease, or cancer, people or on long-term steroid or immunosuppressive therapy, close contact of TB patients, and malnourished people. So, what are the possible complications may happen with this TB? So, severe lung damage, okay, respiratory failure, spread to other organ like brain, spine, kidney, etc., permanent disability, and death. So, early detection, complete treatment, TB can be treated. Next, let us discuss about the asthma. This is another life-threatening disease. So, asthma is a long-term chronic disease that affects the airways in your lungs. It causes them to become inflamed and narrow, leading to breathing difficulties. With the right treatment and care, asthma can be well controlled and you can live an active, healthy life. So what happens in asthma? So you can see the lungs veins, lungs channel become shallower or narrower. Okay, so this is the open airway and asthma airway, inflamed airways, swelling, extra mucus, and tight muscles. Okay. So what are the key facts about the asthma? The asthma is felt by all ages. Okay, it cannot be cured, but it can be controlled. Common but serious if not managed. Is early diagnosis and proper treatment prevent attack and complications. Avoiding triggers and following treatment plan helps to stay symptom free. So, what are the common symptoms for asthma? So, symptoms may vary from person to person and may come and go. So, whistling, like when taking breath, it could make sounds. Shortness of breath, chest tightness and discomfort, coughing, especially at the night and early morning, and trouble sleeping due to the breathing difficulties, fatigue during physical activities. So there are few different types of asthma. So asthma can affect people in different ways, like allergic asthma, triggered by allergens like pollens, dust mite, mold, and then pet denders. Okay, non-allergic asthma triggered by irritant like smoke, pollution, strong odor, cold air, and exercise. And exercise-induced asthma occurs during or after physical activity. And occupational asthma, like caused by substances in the workplace like chemical, dust, and fumes. Cough variant asthma, like main symptoms is a chronic cough. So common triggers for this asthma. So triggers can cause asthma symptoms and make them worse. Like as I discussed, this is the picture. So these are the common triggers for asthma. So diagnosis. A doctor will take your medical history, examine you, and may suggest tests like spirometry test, mucus, measures how much air is inhaled and exhaled and how well your lungs work. Peak respiratory flow, it's okay, checks how well air moves out of your lungs. Allergy test to find allergistic trigger and chest x-ray to rule out other conditions. So early diagnosis helps is better control and fewer asthma attacks. So treatment of asthma. So asthma treatment has two main goals like control symptoms and prevent asthma attacks. So reliever medicines like quick relief, like we can use, someone can use this inhaler, nebulizer, this kind of thing, and controller medicine like this inhaled ICS, all these kind of medicines. Okay. So asthma action zone, work with your doctor to create a plan like green zone, doing well, no symptoms. Yellow zone, caution symptoms starting like coughs, squeeze, tight chest, waking up night. Okay, and red zone, so medical alert, severe symptoms. So very short of breath, severe reliever not helping, lips blue, and then confusion. Okay, so these are the red zone asthma patients. So prevention and asthma management. So simple step to control asthma and live better. So take medicines regularly as prescribed. Avoid or reduce exposure to triggers. Use inhaler technique correctly. Keep your home clean and well ventilated. Okay, exercise regularly. Stay active. Maintain a healthy diet and weight. Stay up to date with the flu and pneumonia shots. Manage stress and get enough sleep. Okay, high risk group again here: children, elderly people, people with allergies, smoker and second hand smoker, people with obesity, people with family history of asthma. So possible complication: so if asthma is not well controlled, a complication can occur like severe asthma attack, and then chronic lungs changes, respiratory infections, reduced quality of life, missed school or work. So when to seek immediate medical care? So severe shortness of breath, reliever inhaler not helping, difficulty speaking or walking, lips or fingernails turning blue, confusion or extreme drowsiness. Okay, so you have to remember few things. Asthma can be controlled. Follow your treatment plan. Avoid trigger. Regular checkups with the doctors. Live actively and breathe better, and then breathe better, live better. So yeah, in short, we can say you are not alone. Asthma is manageable. Take control and stay informed, stay healthy. This is another life-threatening and most dangerous disease, cancer. So cancer is a group of disease in which abnormal cells grow uncontrollably, invade nearby tissues, and can spread to the part of the body. So many cancer can be cured if detected early and treated properly. So how does cancer develop? So it's normal cell, then abnormal cell, then cancerous cell, then growing tumors, and then it spreads throughout the body. Okay. So key factor: cancer is the leading cause of death worldwide nowadays. Millions of new cases are diagnosed every year. Not all cancer are preventable, but many risk factors can be avoided. Early detection and treatment improve survival and quality of life. Okay, advances in treatment gives hope and better outcomes every day. So common sign and symptom of cancer. Okay, unexplained weight loss, persistent fatigue, lump or thickening. Okay, persistence, cough and hoarseness. Okay, change in bowel motions. Okay, sores that do not heal, unexplained bleeding or bruising, indigestion or difficulty swallowing, mold changes in sizes and persistent pain. Okay, and then fever and sometimes night sweats and loss of appetite. So types of cancer, we all know that there are different types of cancer like breast cancer, lung cancer, colorectal cancer, prostate cancer, skin cancer. Okay, so risk factor. What are the other factors that may cause the cancer, like tobacco use, smoking, chewing, vaping, and then excessive alcohol consumption, all in the diet, obesity, physical inactivity, and then exposure to radiation and certain chemicals, chronic infection, family history of cancer, increasing age, prolonged sun exposure. So what are the diagnosis? Physical examination, doctor checks for any lumps and abnormalities, imaging tests like X-ray, ultrasound, CT scan, MRI, all these things. Laboratory tests like blood test and tumor market makers helps in diagnosis, biopsy. So these are the common diagnosis. Treatment: surgery, chemotherapy, radiotherapy, immunotherapy, targeted therapy, and hormone therapy. These are the possible treatment for the cancer. So recovery and supportive care. So always give physical activity, nutritious food, follow-up care, emotional support. Okay, so these are the possible route to get cured. Okay. So prevention: do not smoke and use tobacco. Eat a healthy diet high in fruits and vegetables. Maintain healthy weight. Exercise regularly. Limit alcohol consumption. Protect skin from excess sun. Get vaccinated. Avoid exposure to the harmful chemicals. So screening and early detections. Okay, so these are the some time period when it should be screened and treated. So high risk group again, people family history of cancer, smoker and tobacco user, people with chronic infections, people with obesity and unhealthy lifestyle, people with weakened immune system, people with prolonged exposure to radiations and chemical, and people above 60 years. So there are a lot of possible complications like pain cancer to the organs, metastasis, chronic pain, infection, bleeding, or blockage, organ failure, emotional distress. Okay. So when you seek medical help, so as persistent or usual symptoms, a lump or a thickening anywhere in the body, unexplained weight loss or fatigue, changes in bowel or bladder habit, and sores or wound that would not heal. Okay, so remember, cancer can affect anyone. Early detection saves lives. Follow your treatment fully. Maintain a healthy lifestyle. Stay positive. Stay strong. Never lose hope. Okay. So this is all about the cancer. Thank you, everyone.